what Dr. Price found was a mentally retarded boy who had a very narrow facial structure. His wisdom teeth were crowding, and when Dr. Price expanded his jaw, the child became able to go from home to the grocery store, follow simple tasks, do simple errands. His cognitive faculties grew substantially. He grew about a foot or so in a very short time. And his growth and development, which was stunted because of his narrow pituitary area, maxillary bone structure, became opened up. So it is critical that we examine our faces. In the modern day dietary, what has happened is you see narrow faces, whereas over here you see these wide faces. You see these wide faces, there's plenty of room for teeth in those faces. So what is a tooth? A tooth is not a piece of plastic. Everyone know that tooth is living tissue? Everyone knew that? So every single part of this tooth is alive, folks. And so you don't want to treat it like you would treat a table or a dish or a piece of machinery. There's nerves that are innervating your tooth. There are blood vessels that are feeding. There's immune system. There's lymphatic lymphatic vessels that are going in and feeding your teeth and keeping your teeth from getting cavities. And in this area, you have this thing. This area is called the dentin, and that's called the enamel. And the dentin is made by cells, living cells called odontoblasts. And the tooth is constantly in the state of being made and being broken down. And so the dentin that you're seeing is living tissue that is made by your body. What happens if you have a root canal? You take this out. So what is that tooth? Can you, dead tooth? It is dead tooth. So imagine if I had a hand that did not have circulation, no blood flow, no lymph, no nerves, and I went to the doctor and said, yeah, doctor, I gotta have my hand, and it's gangrenous, but I decide to keep it. What's gonna end up happening is the infection from my hand or the disease from my hand is actually gonna end up killing me. And that essentially is what a root canal is. What a root canal is the tooth here is dead. The tooth is not being nourished. There are no new odontoblasts making new dentin. There's no odontoclasts breaking down the dentin. And so what you're doing is you're propping up a structure. It's rotted on the inside. You see those little lines over here? Everyone see those lines? Those are called dental tubules. Those lines go from here to my home in Larkspur. They're several miles long, those canals. And those are very inaccessible to medicine, to radiation, to chemotherapy, to just about anything. And so guess who they're good for? Who gets to live there? Bacteria. If you don't have an immune system protecting every mile, every inch of those canals, what's going to end up happening is that tooth is going to be a reservoir of just about every kind of anaerobic pathogenic bacteria that's got access to the rest of your body, your entire circulatory system. So people with dental disease, you find, get heart valve infections. These bacteria travel, make their way from there through your circulatory system to your heart muscles, to your valves, and you have conditions like endocarditis, arthritis-like conditions, constant inflammation in your body. Yes. So the simple answer to the problem of root canal is you should not have a root canal in your mouth. You're almost guaranteed infection in the root canal. You're almost guaranteed knock-on effects into your body from the root canal. Your dentist cannot tell you that. Weston A. Price was an unusually honest dentist. He was interested in health, not in dental billings. But what's going to happen is, if you have a root canal, essentially you're propping up a dead arm inside your body, and the dead arm is not supported by your body's immune system, circulatory system, or nerves. So it looks pretty, but it's a big liability to you. The alternative is to pull out the tooth and to place a bridge, but not an implant. And we'll talk about implants as well. Implants raise all sorts of autoimmune reactions in your body. Chronic degenerative disease is caused by implants, and more data is coming out on implants. So the enamel is laid from the inside out and from the outside in. And does anyone know the role of saliva in your mouth? Helps you digest the food, absolutely. It also does another important function, and it's probably even more important than, well, digestion is pretty important too, but it lays down your enamel on top and mineralizes your enamel. So you always want your saliva to be in touch with your teeth. When you use toothpaste that have layers of glycerine, or that have glycerine in them, or things that make your teeth feel really smooth, those are the kinds of things that coat your teeth. When your teeth get coated, your saliva cannot precipitate out minerals on your enamel. You get pitted enamel.
So what do you suggest as toothpaste?
I suggest you take a mason jar. You asked exactly the question I was hoping you would ask. You take this mason jar, pour some, like a quarter cup of coconut oil in it. You put in a teaspoon each of cinnamon and clove powders. You put in a tablespoon of crushed nice sea salt into it. You stir it together, and you use that as a toothbrush. You can use your finger, you can use a very soft brush to brush your teeth. It will nourish your teeth. It will not coat your teeth with something that the saliva cannot get through. It'll make your teeth smell beautiful, it'll keep pathogens out of your teeth, and it'll keep your teeth in pristine condition for much of your life. So between the oil pulling, making your own toothpaste, if you're too lazy to make your own coconut toothpaste, you can simply take cinnamon powder. You can simply take clove powder. You can mix cinnamon, clove. This is like $4. 4 3s are 12. You mix 3 of these ground spices together. You have the most amazing smelling tooth powder. It's made of woody substances, so that it's not abrasive at all, and it's extremely delicious and healthful for you. So I would recommend you don't put into your mouth anything that you cannot eat. It's particularly true for little children. If you've got little children, do not let them get near a toothpaste. Give them things like this, and if they eat them, then they'll be healthier for it. So if you looked at the structure of the teeth here, this is called the pulp. This is the pulp of the teeth. And this is sort of the soft structure, this is the harder structure, and this is the enamel. And this is where the odontoblasts are. So these are the living cells. This is just a picture of the odontoblasts. And the odontoblasts are going out, laying enamel through those canals. These are the canals that the bugs like to hide in if you have a dead tooth. If this tooth doesn't have an immune system in it, pathogens are going to get into this, and you don't want a tooth like that in your mouth. So the odontoblasts help to lay down the bone matrix, the dental matrix, on your dentin, and frequently when you get pitting, the enamel gets exposed and your dentin then gets sensitive. The solution to that is oil pulling on a regular basis and using toothpaste that allow your saliva to remineralize your enamel. That's one thing. But the main thing you need is for your body to have which 4 fat-soluble vitamins? Yeah. Fat-soluble vitamins A, D, K, and E. Huh?
Not from supplements.
Not from supplements. Supplements are very synthetic. You get them in food. Coconut oil has vitamin E in it. the raw butter that they have over there, it's nature's gift to mankind. It has fat-soluble vitamins A, D, K, and E. And your dental disease will reverse if you eat raw dairy products. So I would recommend for you raw butter, fermented cod liver oil, half a teaspoon to a teaspoon every day until your cavities are remineralized. I would recommend that you oil pull every couple of days or every day, depending on how much gum recession you have. And you eat protein and saturated fats in your diet. And avoid starchy foods like oats, granola. A lot of people who are very organically oriented have granola for breakfast, have sourdough bread. All of those, at the end of the day, are starchy foods. And if you have dental problems, I would recommend reducing those carbohydrates and replacing them with non-starchy vegetables and lots of fats. What do I mean by lots of fats? Anyone take a guess? 8 to 12 tablespoons a day. Fats. Saturated fats. Saturated fats. Yes. 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 Saturated fats.
Okay, we're going into the heart thing.
Yes.
The fats. Yeah.
Saturated fats are very good for you. Don't let anyone tell you that butter is bad for you. Okay. So here we get to the root canal problem. This is not a very good picture, but it does the job. So that's the dentin, that's the enamel, that's your pulp chamber, which has the nerves, the central nerves in it. And these are the periodontal ligaments that attach your tooth to the bone in your jaw. So this is your tooth. And this is the root from which the body nourishes each one of your teeth. So you got to take good care of that. The way to take good care of it is to make sure that through this pipe, good stuff goes into your tooth. And that good stuff is butter, coconut oil, good eggs, pastured, high-quality eggs, lots of B vitamins. Anyone like pâtés? Who likes pâtés here? Eat lots of pâté. Very, very rich in the fat-soluble vitamins, very rich in the B vitamins and A vitamins. So if you feed your teeth from here, you ain't gonna have a problem up there. This is a cross-section of the same tooth. You will see the pulp chamber in the center. And when you take a root canal, you take a post. You take a metal post, you dip it in some kind of rubber, or maybe not rubber these days, other things, and you stick it into that dead tooth. You scrape out the inside of that tooth, you put that post into that tooth, and you call it a day. And the tooth looks very beautiful from the outside, but on the inside, let's see what's happening. That's the house. That's 3 miles of beautiful caves that no human can get into, that are home for a variety of pathogens, bacteria, viruses, and so on. And Weston Price actually did a lot of research on this. He took some of these teeth from dead people, people who had certain diseases. He cleaned out their teeth completely, and then he took those and implanted the teeth under the skin of rabbits, and they died of the same disease that the person did. So the teeth are the bearer of a number of severe pathogenic infections. So what happens when people have root canals is they feel feverish, or they might have heart arrhythmias, or they might have joint inflammation, they might have fibromyalgia, they might have sclerosis, they might have, depression, and they don't understand why. They might have constant recurring infections, and what do? They get more and more and more antibiotics, but the antibiotics cannot get here. The antibiotics cannot get here. After the dose is over, these bacteria get even more virulent, and you have yourself a repository of constant disease. Who did hear that? She was saying people with cancers and heart disease. Did you say all the cancers they all have, without exception, root canals? Infections travel, disease travels from these, and there's no solution. If it's a leaky boat, there's no solution.
So if you've done these things,
It's not at all too late to start. However, if it's a root canal, I would pull my tooth out. I would pull my tooth out, put a bridge in place, not an implant. An implant's going to do the same thing. You put in, instead of putting a post into your teeth, you're now putting a post into your bone. And what happens when you put a metal post into a bone? The titanium oxidizes. The body throws an immune response to that metal. And before you know it, you have multiple sclerosis, you have fibromyalgia, you have all the symptoms of chronic degenerative autoimmune disease. And I have seen people where people pull them out and they get better within days and weeks. So that's the dentin tubules that harbor a lot of pathogens. What happens when you pull the root canal, when you pull the pulp out, is there is still bacterial infections at the apex of the tooth, and those serve as nodes of infection into the rest of your body. And if anyone has had some kind of conditions or diseases, if you hark back, if you think back, you will remember you were feeling fine, and then one day suddenly you just didn't feel good. And you went to the doctor and said, "Doctor, I just don't feel good." Or I feel low energy. And the doctor will test you and look at everything and say, "Oh yeah, no problems with your blood, x-rays are clean, this and that." And by the 5th visit to the doctor's going to start prescribing. Yes, the doctor's going to start prescribing antidepressants to you. And that is one of the problems. And you know what happened to your body. You were fine one day, and then the next day you were felt. And that is a classic sign of an infection, frequently an infection of dental origin. Here's a cavitation. With all the wisdom tooth removal, what's happening when you remove the wisdom tooth is your teeth were anchored with these ligaments into your bone. And if the dentist did not do a good job of scraping the insides of the holes, you're going to have the same problem when the gum line closes over these cavities. So make sure whoever has had wisdom teeth removed that your cavitations are super, super clean. All these ligaments are removed and there's no apexes of infection inside your wisdom teeth if you're feeling constant illness or if you're feeling constantly some symptoms or the other.
That would be true with the root canal too, right?
Root canal for sure, yes. But in the case of the wisdom teeth, they've pulled the entire root out, whereas in the root canal, the side of the tooth is still there. So these ligaments